Good evening, everyone. Thank you so much for joining us for another midlife menopause chat. I'm your host, Dr. Melanie Ochalski, a reproductive endocrinologist and certified menopause practitioner at WellSpan Midlife Health. And I am thrilled to be joined tonight by Dr. Soltanian, a plastic surgeon at WellSpan Health. Thank you so much for joining us tonight, Dr. Soltanian.
My pleasure.
Those of you that have joined me for previous chats know that each month we discuss a topic that is relevant to midlife health. So we have addressed topics like the cognitive changes that occur, cardiovascular health in midlife, and even orthopedic issues. But tonight we're going to talk about something that is very different from previous topics: how our bodies change externally and what we can do to address it. And the impetus for this topic actually comes from my patients and a lot of audience members who commonly will say, I feel like I'm still 30, but why, when I look in the mirror, do I see a 50 and 60-year-old? And as a woman, I can vouch for the overwhelming confusion for all the products and procedures out there. It's hard to know what to do first and when. So that's why we're so happy to have you, Dr. Soltanian. What if I jump right in and ask, what are some factors that accelerate aging that off the bat we can just avoid in order to prevent some of the aging that inevitably seems to happen?
Well, thank you very much for the opportunity to talk to everybody. You brought up a very important point. I think in the last few decades, there have been a change towards cognitively everybody remaining much more active and involved, even into more advanced age. When a couple of generations back, people would be retired for a long time and they felt just old, and we don't feel old anymore because we are still active and participating in all aspects of life. On the other hand, there have been also tendency to be more out there, and there was a wave of using more, cigarettes and tobacco products, and we know now that sun exposure is a big factor in signs of aging, if you will, externally on our skin, contributing to changes we all associate with older age, older appearance, leading to thinning of the skin, appearance of wrinkles, and not to the least, skin cancer, different types of skin cancer. So sun exposure is a major factor, and smoking is another factor. Though if we can from early age on control those two factors, we probably all would look, a few years younger for a given age. And there have been studies, actually I participated in a study looking at identical twins who had different exposures. And, definitely sun exposure and smoking, as well as skincare products, taking care of your skin, using moisturizers, they were all positive factors in terms of slowing down the external aging signs.
That a perfect lead in for my next question, which is, are there products that as a foundation all women should use on a regular basis?
So I don't think there is a one size fit all kind of approach here, like many other things in medicine, but principles are probably applicable to everybody. So sun exposure, avoidance of sun exposure, sun protection with any product which has SPF, and you need to reapply those. So so there is always a false expectation that if you're out and about, you apply it in the morning as you go out, for example, on a hike or so. and it is good for the rest of the day. That is not true. You have to reapply them. You do need high level of SPF, probably 50 and above. And moisturizers. You need some very basic, it doesn't have to be anything fancy. You have to moisturize your skin because we all constantly lose moisture. And that's also one of the major issues as the skin gets older and becomes thinner. We lose more fluid and moisture. So keeping the, if you will, water content of the skin at a higher level is really helpful. And people can probably try different products. And as I said, they don't have to be really expensive products, and see what works for them, what feels good on their skin. Some people can't stand, for example, the greasy feeling of some of the products. And so they all could be helpful. And one last thing is also cleansers. At the end of the day, you should definitely use some, again, it doesn't have to be something fancy. Even, sometimes, just plain soap would work for some people. Some other um, uh, individuals who have a tendency to have drier skin, just normal soap would not be a good idea. Sometimes, you have to use something which is detergent free. Again, it would be good to talk to somebody who has knowledge about these things, and based on your skin type, they could recommend a product which would, help you taking care of your skin on a daily basis.
And are there any over-the-counter secrets that you know of, like Preparation H to tighten skin, that has been shown to be effective?
So there are a couple of things. First of all, the number of products available out there is just unbelievable, and nobody can really keep track of, all the products out there and their, are they effective or not. Preparation H, sort of, it's a funny thing. Obviously it's a product, over the counter for hemorrhoids, but it so happens it has two ingredients which also help um, baggy skin under the eyes, and the two factors are low-grade steroids and also vasoconstrictors, which have a tendency to help with the swelling and edema and improving the appearance of baggy eyes. I personally, haven't had patients using it for any extended period of time, and I haven't seen any studies done. So okay, if it works, I think it does work to some degree, and probably it varies from person to person, because also when patients come to be evaluated, for example, for eyelid surgery because they have baggy eyes, they're not all the same. The problem is not always the same thing. There are variation of it. So I can imagine that also Preparation H may work better in some people or not at all in other group of people. And then the other question is it the lasting thing, or or are you going to lose the effect at some point? And one of the things I tell my patients, because I get questions like this all the time, also about scars, for example, scar treatment. And I tell them, if you go online and search for something and you see there are 50 or 100 different solutions for that problem, what does that tell you? It tells you that none of them really works very well. Otherwise, the other 99 wouldn't exist. So, and that's sort of the same thing about skincare, about baggy eyes or wrinkles. So you have to, really be judicious, talk to people who are knowledgeable, and be able to find a tailored approach for your situation, because everybody's skin is also not the same.
Okay, so when a patient comes to your office, and she just is complaining that everything just seems a little older and she wishes she could look 5-10 years younger, what are some of the things that could be possible solutions for her?
Definitely. So obviously, the appearance, the aging or appearance of an aged face is a sort of a subjective thing. And as human beings, we are to some degree programmed to conceive and perceive certain things as old and certain things as young. For example, we all associate rounder face, fuller face with younger face because babies have round, full faces, and that's how we are programmed. Somebody who loses a fair amount of weight after the age of 40 or so, they tend to look all of a sudden older because that's how we are programmed. They didn't do anything wrong. They weren't in the sun. They didn't, damage their skin. It's just they lost volume. And some of those changes also happen gradually over time. So we all actually lose volume in our faces. Some of it is the thickness of the actual skin. Some of it is the fatty deposits we have in certain areas, for example, over the cheek area, over the the lower cheek, and we call it buccal areas. And then on top of it, the ever existing gravity, the effect of gravity. And the attachments and natural attachments of the skin to the deeper structures, which keep everything in place, slowly have it, continue to go down and, fall down. And that leads to wrinkle formation, jowling, and, under the chin, and also even the fatty deposits. Not only they become um, sort of less smaller, if you will, they lose volume, but also they descend and are not where exactly they should be. So depending on the situation for everybody, we try to recreate the more youthful situation in terms of what changes has happened to them. And that happens to different people at different speed, if you will. Sometimes you have patients or individuals, I hate to call people patients because people are not sick. It is just something we want to improve upon. Sometimes people come in and you see them, actually they're in their 60s and they have an amazingly youthful appearance still. You would never guess that they're 60, and they didn't have necessarily surgery or did anything in particular. It is just how their genetic build is. And on the other hand, sometimes you see women or men, in their 40s, and they already have very distinct fold formation and crease formation on their foreheads, and that contribute for us, as human beings, we associate those changes automatically with older people. So depending on what is going on, we can really help reversing, if you will, or erasing some of that those changes. If it's a question of loss of volume, that can be replaced with fillers, which they don't require any invasive surgery. There are different variation of them, and I'm not going to get into all the details because, again, there are so many of them. Ultimately, they're providing additional volume in a more or less natural way to the areas where we want to see fullness, over the cheek areas, for example. And most of them are temporary, but some of them can last over a year and a half to 2 years. Every day companies come out with new products which tend to last longer, and so that's one option. Now, the ultimate filler in my book is patients or people's own fat. We can, because again, the fullness of the cheek is primarily fatty tissue, so we can actually harvest fat from the person themselves and transfer it to their face to make the face look younger. Then we talk about wrinkles and folds, fine wrinkles on the face. Oftentimes you see that, with smoking and also sun exposure. Those essentially require a change of the texture of the skin. And that means, performing a procedure to resurface the skin. And that can be something chemical, over the counter peels, which are good, but they're not as effective depending on what kind of results somebody wants to see, to very aggressive resurfacing with lasers, like CO2 laser, which would be a much more involved sort of procedure, but also a really smooths out the skin from those fine wrinkles. Now, creases like over the forehead and the, nasolabial folds, those also is a combination of volume, but some of them are dynamic, meaning, affected by muscles, especially on the foreheads. So when we raise our foreheads to, look surprised or open up our eyes, we create wrinkles, and over time, those creases become noticeable. And in order to avoid that, we could use Botox, which is a chemical which paralyzes the muscles. And when the muscles are not moving, then we are not going to see those wrinkles, and everything looks smoother, and we associate that with younger appearance. The same thing with Botox can be used for the corner of the eyes, so to a lesser degree, small creases on top of the lips. So these are less invasive procedures. For more severe, or if you mean more noticeable change, there are surgical procedures where we try to, again, recreate the younger appearance, such as facelift, neck lift, and some of these can be combined. For example, laser and neck lift, or some fat grafting and lifting procedures. But the goal generally is to, as you said, take away a few years and not make people look artificial, not look, most patients or most people who come to us, they don't want to look like somebody who has had surgery. They want to just look refreshed, look few years younger, but still look like themselves, not like some of the people we see on magazines and in the media.
Do most people do things sequentially? So start with less invasive techniques like Botox and then filler, and then progress to something like surgery, or is that not necessarily necessary?
So it is, I don't know if there are any statistics out there in terms of people who are, I mean, the number of people who are, getting fillers and injectables, if you will, it's really in millions. And that's a very large number. And because of the fact that they're less invasive, less expensive, there's no downtime, essentially, a lot of people, turn to those procedures. But that's not a prerequisite to have something more invasive. And as because of the fact that we hear and see all of these things all the time on media, a lot of people pick up on it, and they start, for example, with skincare, which is very important. You need to have that basis of, taking care of your skin. We take care of, excuse me. Sorry, I'm getting over a bad cold from 2 weeks ago and still is not over.
Oh.
So people hear about different procedures, and they start with, for example, skincare, which is very important and should, we recommend it before and even after surgery. I was saying, people take care of their heart as an organ, they take care of their brain, they take care of their lungs, they take care of their muscles. Meanwhile, actually, skin is the largest organ in our body, and people tend to neglect that. But again, the awareness is definitely increasing, but you don't need to go in sequence. It is generally considered better to start early to take care of your skin, and if you need smaller procedures, and you just every few years you're just touching things up, rather than waiting until you look really, if you will, old, and then having a major 8-hour tour de force cosmetic procedure to do everything, forehead and mid face and neck and the eyelids and the nose and then the laser. Sometimes people have those procedures, but I think that's a little bit too aggressive, and it also requires a lot of recovery time.
That's a really good point. I'm glad you brought it up. I think there's a feeling that one should wait until they're older to have some of these more invasive procedures done, but that's not necessarily
No,
necessary.
that is not necessarily true. You can have smaller interventions and maintain your skin in a better shape. And comparing, let's say if you compare a person to herself or himself without any skincare, and they turn 50 and all of a sudden they need, as I said, all of these procedures, versus when they were at the age of 30, they started really with routine skincare, then they had maybe on and off Botox injections, so they didn't get all of those deep creases which muscles create, and then they had maybe a little bit of fillers. By the time they are 50, then their skin is and their face is going to look so much better, and then they may need just a minor lifting or nip and tuck kind of thing, but it's a much less invasive procedure than doing a completely true full face, for example, procedure.
Gotcha. Okay, 2 questions before we move on to the rest of the body. The first is, does insurance cover any of these procedures?
So it's hard to know. It varies from insurance plan to insurance plan, but most of the time they don't. Insurances, generally speaking, again, there are always exceptions. Generally speaking, insurances would like to, or they say that they cover procedures and interventions and treatments which are medically necessary. So medically necessary means that if you don't have it, you are going to suffer some further harm or unhealthy consequences. And it's hard to argue that, for example, if you don't have Botox injection for wrinkles, you're going to have that. So that's why by and large the insurances are staying out of it.
I've been surprised, though, to learn of some policies that do have a benefit, and the examples I've seen are employers that they're in a public light, so they're in media, and so there's this benefit for things like that. So I guess it's not impossible, but probably not the norm.
It is not the norm, definitely. But again, it is just almost like any kind of insurance policy. Health insurances also vary, and you can purchase certain benefits and leave certain benefits out, and that also changes your monthly payments for them. So,
Right.
yeah.
And the second question is, are there any vitamins that you would recommend that can delay aging of skin?
So not directly. So people, we are all really hung up or stuck with the supplements. If you look into the media or TV ads, it is unbelievable the number of different supplements, and unfortunately also supplements are not really regulated by FDA. Because they're not medications, they're flying under the radar. So people and companies can claim all sort of things without necessarily proving that it is true. So if you have a healthy diet and healthy lifestyle, you shouldn't need any additional multivitamin or any other kind of supplements. I said indirectly because we all have heard about retin-A and retinoid creams for facial treatment, which is actually a good baseline topical application. That's a derivative of vitamin A, but that doesn't mean that if you ate ingested vitamin A, you're going to have the same effect. So be careful. You don't want to overdo it with vitamin A systemically in terms of taking it by mouth, but topically, retinoic acid, and there are different variation of it. They're all very good, and you have to again go through a process of starting low at a lower concentration and building up to a maintenance level at the higher concentration.
And another question related to this just came in. What about collagen? Topically or ingested? Do either help with skin?
My answer is I don't know. So it's just at the very basic medical science of it, it just doesn't make sense. But I don't want to claim that I know everything. So when you eat any kind of protein, and collagen is a protein, our body essentially takes it apart into its building blocks, which are amino acids. So ultimately, your body doesn't know if you ate collagen at the tune of several $100s in a powder in a box advertised by a good looking actress, or you just ate a piece of steak or fish or chicken. So I really haven't seen any studies yet. Not that I have necessarily researched it, but it hasn't usually big breakthrough stuff like that, it comes across for plastic surgeons very quickly. I have not seen anything indicating and showing that ingesting collagen or rubbing it on your skin is going to make a huge difference. But again, I am also saying that I haven't done an exhaustive research on it, so I don't know.
I like that answer. Okay, so here's a question I've been waiting all night to ask. What's the mommy makeover?
Okay. So, so the assumption is that, women, generally speaking, they're going to have babies in their 30s, late 30s nowadays, and then, they also breastfeed, and we know that pregnancies and breastfeeding, causes some changes. First off, I have
That's
to.
putting it mildly.
Yeah, well, so when my wife was pregnant, with our two kids, I used to say pregnancy is a disease. It's a dis-ease. Women are not really at ease when they're pregnant. Am I wrong? On the other hand, I want to set something straight. I did a study several years ago, again, the identical twin study, looking at different factors, and breastfeeding does not make the breast look worse. Okay, so yes,
That's
it is
surprising.
published. We published it. This is in the journals, peer-reviewed journals, and So I want to take that myth out of clear that myth that breastfeeding does not make your breast look worse. What it does is pregnancy. So as soon as you commit yourself to have a baby and you become pregnant, the other one of the consequences, one of many consequences, is the fact that your breasts are probably not going to look as good as they did before. So if you breast, so I want to make sure that people don't sort of refrain from breastfeeding just because they think that their breast would look worse if they did that. So that's number one.
That's
But
a great, I'm going to shout that one from the rooftops. I'm glad
yes, because again, you are the expert, but I think breastfeeding, breast milk has so many advantages and so many benefits for the babies that I think it would
Mhm.
not be a good thing to withhold that just because of the appearance of the breast, because again, it's not making a difference. Um, so so considering all of those things, when women are generally around the early 40s or so, they all feel like, okay, their bellies are not looking as flat as they did. Their breasts are not looking as, for lack of a better term, perky and healthy and youthful as they did. And they would like to do something about it, especially again, in this day and age where everybody is very active, everybody is involved in, or a lot of people are involved in sport activities and outdoor activities, and they want to look good. They want to look, they want to feel good about themselves. So there are procedures where we can help with those changes, and again, not necessarily reverse, but make those areas look better. And primarily, it focuses on breast appearance and belly appearance, and there are a number of different procedures which can um, affect that depending on the situation. Sometimes actually after all of that pregnancy and everything else, the breasts are too big and too droopy, so women wish to have smaller breasts, for example, and the breast to be lifted, so excuse me, they don't have to wear tight bras, and the weight of the breast is not pulling on their neck, so they may benefit from breast reduction, which to a good degree is covered by insurances. Sometimes if for the abdomen, we do abdominoplasties. It can be combined with liposuction to just help contouring the trunk, the waistline, and the abdomen. Sometimes after women are done with childbearing and finish breastfeeding, the breast involute and they deep, in a sense, for lack of better term again, deflate, and women have the desire to have the fullness they had before. And in those situations, oftentimes, we use a breast implant. So it's a breast augmentation. And these procedures can be combined. So a typical mommy makeover procedure is usually a breast procedure and an abdominoplasty, but doesn't mean that everybody has to have both areas operated on at the same time or at all. It's all a personal decision. And I tell patients, whatever you want, makes you feel better about yourselves, that's what you should do.
So two great questions have come up. One, can stretch marks be addressed during a procedure like this?
So that's a very good question. Unfortunately, there's really no good, how should I say, topical treatment for stretch marks. What the stretch marks are, when the skin stretches rapidly, especially during pregnancy or weight gain, sometimes that causes stretch marks too. The deeper layer of skin, the dermis, tears actually, and that causes the stretch marks. And it doesn't go back. No matter what you do, it doesn't go back. But on the abdomen, excuse me, when we do an abdominoplasty or tummy tuck, the majority of those stretch marks can be removed. Small, depending on how they're distributed, usually they're on the lower abdomen. So most of them are gone. Some, if the stretch marks are still very pink and prominent in that regard, from a color standpoint, sometimes superficial vascular laser treatments actually help with decreasing that redness and that prominence. But ultimately, there's no topical treatment for stretch marks.
And another question is, during a procedure like this, can some of the fat that's removed be put someplace else?
The answer is absolute yes. Actually, we have come to appreciate fat significantly over the last 10, 15 years. So we really like to preserve fat. At the same time, there's also some people have the notion that liposuction is the solution for all problems, and it is not so. Liposuction really works for very limited localized issues. Where everybody has their problem areas, men and women, by the way. And so liposuction is a perfect solution for that. Now that fat can be definitely used as a filler. We talked about injectables, that the patient's own fat can be used as a permanent natural biological filler. And the other thing about fat is that fat also contains stem cells. And when we are doing fat grafting, we are actually transferring stem cells, which help wherever you inject it. So it has regenerative, capabilities, and the quality of the skin, the quality of the tissues, surrounding tissues improve. So we are now fat grafting, face, as I said, certain areas, nasolabial folds, the cheek areas, deeper creases, maybe sometimes on the forehead and above the nose, and then also breast. To a limited degree, breast is, you have to be careful, because you don't want to, change the normal architecture of the breast. So when patients are having their mammograms and everything, there is no question of now, is it a new change from fat grafting, or is it really something we need to worry about on the mammogram? So but it can be used. It is still possible to use fat. And then for other areas, some areas people are using fat to artificially create six packs. So without workout, so the fat from waist area can be injected over your, muscle in the center of the abdomen, and create sort of sculpt structure, which looks like you have a real six pack. Yeah, we do fat grafting for a number of different things, and it can be a very good procedure.
That's so fascinating. I had no idea that there were stem cells in fat.
It is, as a matter of fact, I worked for a while with a urogynecologist, and he was studying. I was giving him human fat for studies, and he was doing animal studies to look at, like pelvic floor problems and incontinence, and and they had some actually positive results. I don't know if he ever converted that to actual clinical application or not, but there's something to be said about fat.
That's incredible.
Yeah.
So if there are listeners at home that are excited to learn more and talk about how some of these techniques might help them, can a patient self-refer to your practice?
So the answer is yes. For this kind of questions, evaluations, and discussions, you don't need a referral. So you can just contact our office and set up an appointment, and just give us an idea what are the main topics or areas of concern, and we would be happy to sit down, go over everything, do an examination, obviously, and discuss what the issues are. But unlike other medical, situations, patients really drive the discussion, when it comes to rejuvenation and sort of erasing some of signs of aging. So I always ask patients, when patients have multiple questions or concerns, I try to help them prioritize it, sometimes, and I tell them, if I had a magic wand and I could fix one thing for you right now, what would that be? And that's sort of, it is funny how quickly people actually answer that question. I'm surprised, right away, say, oh, it's my belly, or it's my breast. There's not much of sort of hesitation there. So
That's so
yes, they can, everybody can contact us, and we would be happy to go over everything with them.
perfect. And at the end, we're going to put up your contact info. There have been many questions related to specific products that I think we'll hold off for a future webinar that maybe we can dedicate to skin products. But there's just two more questions, if you have time, that you, if I could ask you, I think you'd be a great resource. One is, does exercise and working out help with the sagging of breasts as we age, or does it make it worse?
I don't think exercise is an independent sort of factor affecting the breast appearance. Generally speaking, if you're exercising and you are fit, it's a good thing. I don't think it would make your breast look worse because you are running, for example. Now, the reverse is true. So patients who are really avid athletes, they like to run a lot, they like to ski or play tennis or so, oftentimes they are, they feel they're handicapped in a sense with the size of the breast at a size where other patients may be just completely fine with it. So I have patients who come and say, okay, I really don't like my breasts because, they're in my way. I like to run, and they're heavy, and they're pulling on my back and give me a headache, give me a neck pain. And then also I get rashes and all of that stuff. And they want to have smaller breasts, where somebody else may be happy with that breast size. So it's a very subjective, very personal decision. But the fact that you're running is not going to make your breast necessarily look worse. I tell everybody, and again, that also has been studied. We did that again as part of that twin study. Identical, looking at identical twins, the twin who wore bras, supportive bras, longer and more often, they had better looking breasts than the ones who didn't. Now I know that it's a sort of um, um, hot topic in the sense that a lot of women don't like wearing bras, and I understand it is just, uncomfortable. And but gravity is a fact of life. So and the heavier the breasts are, the more pronounced the breasts are, the more they weigh, and the more the effect of gravity, pulling on the soft tissues. And our body adjusts to external forces. So as a woman with moderate sized breasts walks, every step is like a pulling action on the breast and stretches the tissues. So trying to negate that with a bra, at least during the times of activity, would be probably helpful.
Okay. Okay. Well, I'm so grateful for you spending time and going over this topic that I think confuses and overwhelms a lot of us women.
By the way, it's not only women. I have to say now, over the last 10 years or so, more and more men, are seeking the same procedures, the same interventions for aging and reversing aging, signs. So it's a common problem or concern.
That's very interesting to know. And list participants, you have submitted some really great questions, and specifically the ones about different products and how they affect our skin. We will dedicate another webinar where we can really delve into those, because they're really good ones. Well, I am going to say goodnight and let Sue do our closing remarks. And again, Dr. Soltanian, thank you so much for joining us.
Absolutely my pleasure. Thank you very much.